Hi, my name is Miriam. I'm one of the Mechanical Circulatory Support Coordinators at the University of Kentucky Chandler Medical Center. I'm here today to demonstrate how to appropriately change a driveline dressing on left ventricular assist devices. Joining me today is my friend and patient Ned, who will be allowing me to demonstrate how to change a daily and an extended driveline dressing. Included in the daily driveline dressing kit is the Silver Cell 2x2. As you open up the kit, you will find the directions on how to change the dressing. I'm going to set these aside. You will also find two masks, one for the patient and one for the caregiver who's changing the dressing. Clean gloves, one pair. Alcohol swabs to assist in removing the current driveline dressing. Inside the kit, you will find one pair of sterile gloves, 4x4 of gauze, a sterile saline wipe to clean the driveline, 2 ChlorPreps, split 4x4s, and whole 4x4s. You will then find skin prep, which is placed on the skin to assist with adhering the dressing to the skin. The Coverderm, or the top dressing, and what we like to call the pants to the dressing. We're first going to start with a daily dressing change. Here at UK Hospital, our LVAD patients use the Centurion Daily Dressing Kit. It comes with an outer package. Before you remove the inner package, please ensure that you have utilized hand hygiene and you are using a clean surface. You will remove the inner package out. The kit is in a separate package, and you also have the Silverline 2x2, which we will set aside for right now. You will peel away and remove the kit gently from the outer package. You'll begin opening the kit. You will place a mask on yourself. And you will place a mask on the patient. Is that okay, Ned?
That's fine.
All right, wonderful. Then, if you need the directions, you can open them up and set them aside. Then you will place your gloves on yourself. You will first remove the driveline from the Foley anchor. I'm not going to change this Foley anchor today because the Foley anchors can remain on the patient for up to 1 week. I will then take my alcohol swabs and open them up and use these to easily remove the dressing. You can tear the pants up to the middle. It's important to rub the alcohol swab underneath the border of the driveline dressing. I'm going to get another alcohol swab. Now, I'm sure some of the men that are watching this video are wondering what the best way to handle the hair that grows on their chest and abdomen. Unfortunately, we do not recommend shaving the abdomen, and it's for safety reasons, because if you shave it, you could run the risk of developing an ingrown hair, which could then turn into a driveline infection. So you'll continue removing the gauze and the silver, and now we've got the driveline completely exposed. At this point, you'll want to remove these gloves. I'm going to set the silver over here, and we will open up the kit. Everything inside this kit is sterile, so you cannot touch anything once you have put your sterile gloves on outside of your sterile kit. Before I put my sterile gloves on, I'm going to get the silver, very carefully opening it and dumping it on your sterile field like so. You will then remove your sterile glove kit and place your sterile gloves on in a different surface. So I'm going to use this table Sometimes these gloves are a little tricky to get on, so it's important that you take your time and be patient. All right, now we're ready to proceed with cleaning the driveline. The first thing I want to demonstrate is to tear the silver. We do not let our patients use scissors. So you tear to the middle like so, and then set your silver aside. Under this gauze, you'll find the sterile saline wipes, which you open. Take the 4x4s, pick up the driveline, and you'll use this sterile saline wipe to cleanse the driveline itself. And then you will discard. You will not put it back on your sterile field. The next step is to use the ChlorPreps. You have 2 of them. You pop them like so, gently shake, and the fluid will move down into the foam part. And you start cleaning. You will start closest to the driveline. This is friction-based cleaning. And then you'll work your way out. Discard. Let this dry for just a little bit, about 30 seconds. It is important that you let this dry naturally. You would never want to wave it dry or blow on it. All right, so we'll do a second cleaning, starting closest to the driveline. And then work your way out. Okay. And discard. Now we're going to let that dry completely before we first put the silver on. Doing okay, Ned?
Doing great.
And I also want to note that it's important when you're cleaning the Driveline with the ChloraPrep that you not move in a circular motion. We prefer to do a square and then work your way out. All right, I believe that's nearly dry. So we'll take the silver, which we have just torn in half, and gently wrap it around. I like to tuck it underneath so it relieves a little bit of pressure from the Driveline resting on the skin. And then you will take your 2 sets of the split 4x4s, place one towards you, and then take the other half and go underneath the Driveline away. At this point, you will then take a couple of pieces of this solid 4x4 and place on top. All right. So now we are almost done. We're ready to use our skin prep. And the purpose of this is to keep your Coverderm sticking to the skin so it doesn't fall off or peel off in between dressing changes. So gently open, and it's rather liquidy. You will rub it around once outside the border of the gauze. And then you also want this to dry very well before you do the second application. You can kind of tap on it to see if you feel stickiness. And I can feel some stickiness. So we'll start with the second application. All right, again, we're going to let that dry very well. As you're standing here waiting for it to dry, it's important that you keep your sterile hands out in front of you so you don't accidentally touch anything else that would damage your sterile field. Looks like it's about dry. All right. Now we have the Coverderm, which goes on top, and the pants to the Coverderm. You will first use your large Coverderm, remove the top adhesive, and then very carefully line it up outside of the gauze. Rub on it so it sticks. Keeping one of your hands on the Coverderm, remove the lower adhesive and walk your hand down as the adhesive comes off. It's important to rub very well as that activates the adhesiveness of the bandage. Okay, and then you'll discard. And the last part is the pants. This goes underneath the Driveline. It's quite easy if you leave the tabs on first and put it in place, and then from the back and the bottom, slowly remove the adhesive. And then you'll do the last one. And here is the label for the date and time that the dressing was changed and who it was by. So you can mark this. Remove. And put it anywhere on the dressing that you prefer. Then we'll take the Driveline and place it back in the Foley anchor, pushing the bottom tab into the upper one. All right, we can remove our sterile gloves. We can take our masks off. And we have successfully completed a daily dressing change. Thank you, Ned.
Thank you.
You're very welcome.